Very good morning, everyone. My name is Snehal Bongarde. I'm working as an assistant professor in DY Patil College of Pharmacy, Kolhapur. Today, I'll be presenting on a very important topic, that is general anesthetics. So, in our today's presentation, we are going to discuss about the introductory part of general anesthetics, where we are going to discuss what are these general anesthetics, what is the importance of the general anesthetics. Next, we are going to discuss about what are the important properties of this ideal anesthetic, why it is important for an anesthetic to have an ideal property. Next, we are going to discuss about the stages of different anesthesia, and the final thing that we will be talking about is our mechanisms of general anesthesia. So the first thing is anesthesia. So anesthesia, it is very important to understand what is anesthesia. So anesthesia is the reversible loss of sensation. Okay, so general anesthesia, so anesthesia are basically of two types. There is local anesthesia and there is general anesthesia. So depending upon the type of surgical procedure, the preferred procedure can be either general anesthesia or it can be either local anesthesia. So as all of us already know, local anesthesia is restricted to one particular area or one particular part of the body. As well, general anesthesia, it includes the whole body where all the sensations are lost. Okay, so we are going to discuss specifically about general anesthetics. So this general anesthetics, these are the group of drugs which produce the reversible loss of all sensations and consciousness. So here we are going to discuss what are the different cardinal features of the general anesthetics. So very important thing is loss of all the sensations, especially the sensation that we need to lose is the pain sensation. So sleep, that is unconsciousness. So this general anesthesia, they are going to produce the unconsciousness, and side by side there will be amnesia, that is a symptom. Next, there will be immobility and muscle relaxation. So if a person is undergoing a general anesthesia, obviously that person has to undergo immobility and the muscles of that particular patient has to be relaxed to carry out the surgical procedures very efficiently. Next is the abolition of somatic and autonomic reflexes. So all the somatic and autonomic reflexes that are there in the body, all those reflexes will be abolished once the person is under general anesthetics. So the very important part here is whenever we are going to choose a particular general anesthetic. So general anesthetics has a wide range of classification. They can be classified based on the mechanism of action. They can be classified based on the different routes of administration. If we are going to classify general anesthetics as based on the different routes of administration, then they are classified into basically two types, that is inhaled general anesthetics and intravenous general anesthetics. Okay, so in order to choose a correct and very good general anesthetic which is going to fulfill all the requirements, and the requirements has to be fulfilled from the patient's point of view, it has to be fulfilled from the surgeon's point of view, it has to be fulfilled from the anesthetist point of view. Okay, so we are going to study what are the ideal characteristics or what are the ideal properties that a general anesthetic need to have. First of all, according to the patient, it is the anesthetic that we are going to use, it has to be pleasant. The patient should not get any irritation through that particular product. It should not induce any sort of vomiting, nausea, and the induction of that particular anesthesia, it should be fast, and the recovery also has to be fast. So that is according to the patient point of view. So according to the surgeon, the anesthesia that has to be used, it should be adequate, it should produce adequate analgesia, because that is very important. Producing analgesia means we are cutting down all the pain reflexes in the body, all the pain receptors, all the pain reflexes, all the pain sensations will be cut off from the body. So that is very important. It is going to produce immobility and muscle relaxation. So while carrying out the surgical procedure, it is very, very important to produce immobility and the muscle relaxation. So the chemical or the anesthetic that we are going to use here, specifically the ones we are going to use in case of inhalational anesthetics, those anesthetics, they should be non-inflammable and non-explosive. Why it is so important? Because during certain surgical procedures, we carry out this procedure called as electrocautery. So during this, the heat procedures are applied where this electricity is used to produce heat in order to treat some tissue conditions, like in order to eradicate some tissues from the body, damaged tissue cells from the body. So for that particular, these techniques are used. So during this technique, there can be this accidental things can happen where if the anesthetic is having any inflammable properties, so that can be a dangerous thing that has to be taken care of. Okay, so this is according to the surgeon point of view. So according to the anesthetist point of view, it is the anesthesia that we are going to use. It has to be the anesthesia should be easily administered and the control of the dose should be proper. It should have a wide range of safety. There should not be significant fall in BP. The minimal effect, it should have very minimal effect on the heart, liver and the other organs. The anesthesia that we are going to use, it should be potent. It should be requiring low concentration, because the MAC, that is minimal alveolar concentration, is very, very important here in order to monitor the therapeutic dose of that particular anesthetic. The anesthesia that we are going to use here, it should be cheap, stable, and it should be easily available in the store. It should be non-reactive with the rubber tubing or the soda lime. So obviously the packaging, the primary packaging that the anesthesia is stored in or it is packaged in, it should be non-reactive with that particular material as well, because that can be a hindrance while carrying out the procedures. So these were the ideal properties of a general anesthesia according to these three important point of views, that is the patient, surgeon and the anesthetist. Next, we are going to discuss about the various stages of anesthesia. Now, it is not like if we have given anesthesia to the particular patient, means immediately the patient is undergoing anesthesia. So it is not like that. So the patient is obviously, he is going to follow a pattern of stages where finally he is going to end up into anesthesia. So we will see those stages one by one. So general anesthetics, they cause a progressive CNS depression from higher to the lower centers in the body, and medullary vital centers are affected lastly. So we are going to see the first stage of anesthesia, which these stages was described by the scientist called as Goodell stages. And the first stage is your analgesia. So analgesia, it is a very important stage where all the pain sensations in the body are cut off. So the very important thing while while performing a surgery is to reduce the pain or to cut off this pain sensations. So this is what is happening in this analgesia stage. So this is the first stage. Once we give this anesthesia to that particular patient, the first thing that is going to happen is a stage of analgesia. So this is going to begin once the anesthesia is inhaled or it is injected, depends upon the type of route of administration of that particular anesthesia, and it ends up with the loss of consciousness. But in this particular stage 1, the pain sensations are abolished. The patient remains conscious. It is not like in the first stage only he is going to undergo unconsciousness. He will be conscious in the first stage. Then the patient is going to develop amnesia, that is the loss of memory, because whatever the surgical procedures that will be held in that particular time, that won't be remembered by the patient, and even after the surgery the patient can remain in this amnesia state for a longer period of time. So it depends upon the type of anesthesia that we are using. So reflexes and the respiration will be normal in this first stage of anesthesia. Next, we have the second stage of anesthesia, which is called as delirium. So in order to remember this second stage of anesthesia, the one word that you can remember is the excitement. So in the second stage of anesthesia, the patient is undergoing excitement stage. So what happens here? So there will be, it lasts from the loss of consciousness to the onset of regular breathing. Okay, so what happens in the second stage? So there will be excitement that will be seen in the patient. The patient may have some very reactive activities, like he may start shouting, struggling. The breathing problems will be held. There will be rise in the blood pressure, rise in the heart rate. The pupils get dilated. So these are the excitatory symptoms or the excitatory things that we are going to see in case of the stage 2, that is delirium anesthesia. So no surgical procedures can be performed during this stage. Obviously, if the patient is under excitement, there is no way possible that we can perform any surgical procedures on the patient. So this is the stage 2 of your anesthesia, general anesthesia. Next, the patient is going to go under stage 3 of general anesthesia, which is actually called as the surgical anesthesia. So this surgical anesthesia is the one where the actual surgery will be carried out, where the patient is going to have this 4 planes of anesthesia. So in this first plane, the eyeball, the roving eyeballs, they will be fixed. So there will be loss of this corneal reflexes, loss of light reflexes. So this will be seen in the third stage of anesthesia. So there will be, obviously there will be loss of this corneal, and the laryngeal reflexes will be also lost. Pupils will be dilated, light reflexes will be lost. In the fourth plane, there will be intercostal paralysis, and that shallow breathing and dilated pupils will be seen. So this is what exactly happens when the person is under complete anesthesia. Now the patient or that procedure is suitable for performing the surgical procedures. So progressive muscle relaxation will happen here. There will be drop down in the blood pressure, weak pulses, and respiratory depression will be also taking place. So it is very important to monitor this phase, surgical anesthesia. The monitoring pattern has to be very carefully done here. Next, we are going to discuss, that is the last stage of anesthesia, that is stage 4, that is medullary paralysis. Now the surgery is going on. Now this medullary paralysis phase monitoring is very, very important, because if the patient, this is going to specifically affect, it is going to specifically seize your breathing. The breathing will be seized, the respiratory pattern will be depressed, and that is going to have the circulatory failure, and finally the patient can end up getting dead. So the death of the patient is a very important factor that we need to monitor under this medullary paralysis. And that is the very important thing that we need to understand here. Monitoring this medullary paralysis phase, that is phase 4 of anesthesia after surgery or during the surgery, it is very, very important. Now the very important thing is here, how do we keep a monitor or how do we keep a check on this particular different stages of anesthesia? So suppose there is loss of eyelash reflexes, or there is loss of this corneal reflexes or this light reflexes, then we can say that the stage 2 has not yet reached. And if there is loss of pain responses, means the complete body pain has been lost and the patient is not responding to any surgical stimulus that is given by the particular surgeon, then we can say that the patient has reached to the stage 3 of anesthesia. If there is increase in the blood pressure, increase in the heart rate, or coughing with incision, then there will be light anesthesia will be induced in the patient. And finally, if there is drop in the blood pressure or the cardiac or respiratory depression is happening, then the patient has undergone deep anesthesia. So this is what is happening in all the stages of anesthesia. So this monitoring the stages of anesthesia starting from stage 1, 2, 3 to 4, it is very, very important. Specifically, monitoring stage 3 and stage 4 is very important. Next, we are going to see what are the different mechanisms of general anesthesia. See, as I said, these general anesthesia are classified, they are classified based on the mechanism of action. They can be classified based on the different routes of administration. In the routes of administration, they are classified into 2 types, that is, one is inhalational anesthesia and one is your this intravenous anesthesia. So the very important thing that we need to understand here is, since it has a very huge lot of things that it is shutting down all the systems in the body, it is depressing our body. So the full mechanism of this particular general anesthesia is not yet understood. But there are certain drugs where we can state that this can be the mechanism that they are working through. So the very important factors that may be affecting also and that are very important for a potent or for an ideal anesthetic is the lipid solubility and the anesthetic potency of that particular anesthetic. So the anesthesia should have a proper lipid solubility and the anesthetic potency. So anesthetic potency is very important. So how do we calculate or how do we keep a check on this anesthetic potency? So there is one term called as MAC, which is called as minimal alveolar concentration. So this minimal alveolar concentration, it is going to determine the potency of that particular anesthesia. So how it is going to determine the potency of that anesthesia? Like suppose if we have a lower MAC, means the anesthetic agent that we are using, it is more potent, it is considered to be more potent. Means it is like the lowest dose of anesthesia that is required for the particular patient to induce immobility. And that is what we want in anesthesia. So it is the lowest lowest dose that is required to produce immobility in almost 50% of the patient. So that is called as minimal alveolar concentration. So lower the MAC, the more potent the anesthetic agent is considered as. Next, very important thing, this MAC is going to decrease, means this minimal alveolar concentration, it is going to decrease with age as well. So that is going to, age factor is also affecting this particular minimal alveolar concentration. If we are taking opioid analgesics, if we are taking any narcotic drugs along with this particular general anesthetic, so that is also going to have a negative impact on the minimum alveolar concentration, that is our MAC. So this keeping a very good check on the therapeutic drug monitoring system, this MAC is very, very important here. So we are going to, that is the general overview. Next, what are the main molecular mechanisms of the general anesthetics that we are going to study here? So first one is your GABA A receptor. So this is the main target of many of these general anesthetics. So what are these GABA A receptors? All of us know this GABA A receptors, they have the inhibitory activity in the body. So there are two types of GABA receptors. One is your GABA A receptors, one is your GABA B receptors. Where this GABA A receptors, these are more excitatory as compared to GABA B receptors. So most of these anesthetics, they are going to go and they are going to bind this particular, what is called as GABA A mediated receptors. Okay, so they will be inhibiting this receptor, they will be enhancing the inhibition that is mediated via this GABA A receptors. So what is going to happen? There will be this chlorine channel opening will happen, and that is going to eventually lead to neuronal inhibition. So that is going to show an inhibitory action in the body. So these GABA receptors are very, very important. Specifically, this GABA A receptors are very, very important to monitor the mechanism of action of many drugs. Next mechanism of action, this NMDA receptors. So NMDA receptors, these are the glutamate receptors. So these receptors, what are these NMDA receptors? Obviously, they are the excitatory receptors. So if we are going to have a target of blocking this particular NMDA receptor, so that can be the thing that can initiate the mechanism of that particular general anesthetic, correct? Because if we block this excitatory NMDA receptors, what is going to happen? There will be the shutdown of those body responses can take place. So this is going to block this excitatory glutamate actions, and that is going to lead to the unconsciousness, and that is what we want in the general anesthesia. So we are going to work through this NMDA receptors. Next one is your ketamine and this nitrous oxide. So this ketamine is a very commonly used opioid analgesic. This nitrous oxide is a very commonly used inhaled anesthetic. So these anesthetics, they mostly work through this mechanism where they are going to go and bind and inhibit the action of this NMDA receptors. Next, we have also some of the receptors or some of these anesthetics, they can also work through this potassium channel activation. So they are going to activate this potassium channels, which is going to lead to hyperpolarization, and this hyperpolarization situation is going to reduce the neuronal excitability. And we need to, what is our target in the general anesthetic? It is the same. We are going to reduce, or we are going to depress our central nervous system. That is, we are going to reduce the neuronal excitement, and that is what is seen once we have this hyperpolarization through the activation of this potassium channels. Next, what happens? The next very important thing here is synaptic transmission depression. So we have various neurotransmitters, correct? So these neurotransmitters depression is very, very important here. Unlike local anesthetics, like what happens in local anesthetics, they are going to block the axonal conduction. Correct. In local anesthetic, it is only restricted to one part of that particular region in the part in the body. So these general anesthetics are primarily suppresses the synaptic transmission. So they are going to suppress the synaptic transmissions in the body. So this is the various mechanisms, molecular mechanisms through which this general anesthetics are going to work. The very important things that we studied here, first one is they are acting through the GABA receptors, specifically the GABA A receptors, which are having more inhibitory potential as compared to GABA B receptors. Next, they are acting through this NMDA receptors, which are excitatory receptors. So we are going to block this, some of the anesthetics like your ketamine, nitrous oxide, they are going to block those receptors and they are going to mediate an impact. We have the mechanism of action through the potassium channel opening and the synaptic transmission depression. So this is what the general mechanism through which this anesthetics or this general anesthetics are going to work here. Next is we have the CNS effects. So what are the impact or what is the effect of this particular general anesthetics on the central nervous system that we are going to study here? So first of all, obviously, what is the major impact that this particular general anesthetics are producing on the central nervous system? So it is unconsciousness. Correct. So this is going to target which parts in the brain. So the thalamus, the reticular activating system, will be monitoring this consciousness in the body. So that is what is the effect, that is unconsciousness is the effect of this particular general anesthetics on the central nervous system. Amnesia. So amnesia is a loss of memory. All of you all know it is the main part that is monitoring this particular amnesia. It is the cerebral cortex and the hippocampus. So memory and learning is mostly monitored by this hippocampus in the body. So immobility, obviously spinal cord. So this immobility is very, very important here, because whenever it is, we cannot expect a patient to suddenly get up in the surgery, get up while during the surgical procedure. So it is very important for the particular patient to be immobile. So these are the various mechanisms through which this general anesthetics are working. There are certain molecular mechanisms. We studied what are the different receptors through which this general anesthetics are acting through, and what are the various CNS effects of this general anesthetics. Thank you so much.